Good day, nurses. Now let's discuss your paracentesis. Your paracentesis is also known as the peritoneal tap. Okay, so your paracentesis is a sterile procedure used to remove fluid or the excessive accumulation of fluid in the peritoneal cavity through a needle catheter. So, tinatanggal daw natin yung excessive fluid or yung tinatawag natin na ascites. Okay, so this procedure, your paracentesis, we also use this one to diagnose peritonitis and to relieve difficulty of breathing in client with ascites. So bakit nagkakaroon ng difficulty of breathing? Kasi nga may excessive accumulation sa ating abdominal cavity or sa peritoneal cavity natin. Yung tubig na yan, pinupush niya pataas at iniipit niya yung ating diaphragm kaya tayo nahihirapan huminga. Ngayon, dito sabi ko kanina to diagnose peritonitis. So nag-a-aspirate tayo ng ating peritoneal fluid. Okay? Si peritoneal fluid natin, dapat siya ay alkaline in nature. Okay? The color, it should be light yellow. And kapag yan ay cloudy, it means may infection or merong peritonitis. Okay, so anong gagawin natin? What are the nursing responsibility? First, we need to secure consent. Bakit? That's invasive procedure. Meron tayong in-insert needle. Okay, next, we need to check the vital signs, especially the blood pressure of our patient. So, bakit? Kasi nga, pag once na nag-decrease ang blood pressure ng pasyente mo, hypotension, maybe that's the manifestation ng shock. Okay? Pwedeng pag nag-decrease ang BP mo, shock na yan. So, kapag shock na ang pasyente natin, class, agad-agad, we need to position the patient. Okay? Pag nag-shock ang pasyente natin, we need to position the patient into 10 Lemberg position. Yun yung nakataas yung dalawang paa niya. Para yung blood doon sa kanyang lower extremities ay pumunta muna sa heart. Okay? Para magkaroon ng enough supply. And then, weight the client before and after the procedure. In weighing the client, class, dapat same weighing scale and same clothes ang gagamitin natin. And then, measure the abdominal girth. Ano ang landmark natin dito? The umbilicus. Okay? Si umbilicus ang landmark natin dito to check the abdominal girth. So, these two, okay, weighing the client and measuring the abdominal girth, maybe makakatulong yan sa atin to assess if meron para kung merong ascites ang client natin. And then next, let the patient void before the procedure to prevent the puncture of the bladder. Okay, so ano manifestation natin kapag once na nag-puncture yung bladder? May hematuria. Pag umihi ng dugo si pasyente mo, that's already a manifestation na may accidental puncture ng ating bladder. Okay? So, bakit kailangan pa iihin? Kasi nga, pag puno ang bladder mo, distended yan, lumalaki siya. So, mag-i-insert tayo ng needle dito. Dahil malaki si bladder mo, pwedeng magkaroon ng accidental puncture sa ating bladder. Kasi nga, lumaki siya masyado because of distension. Okay? Next, we use gauge 18 trocar na cannula. Kaya ganyan kalaking ginagamit natin. And we need to check the serum protein. Si serum protein natin, the normal is 6 to 8 milligram per deciliter. We also need to check the serum albumin. Your serum albumin, ang normal niya is 3.5 to 5.5 milligram per deciliter. Okay, because your protein is responsible for oncotic pressure. So kapag once na mababa sila, magkakaroon tayo ng fluid shifting that can lead to hypovolemic shock. And then the position, sitting on a chair with feet supported with footstool or placed in high fallers position. And we need to strict aseptic technique to prevent infection or the peritonitis. And we also give local anesthesia para hindi masakit or ma-feel ni patient kapag mag-insert tayo ng needle. And this procedure, it takes 45 minutes. And monitor for urine output as watch out for hematuria. Ito na yung sinasabi ko kanina na baka may accidental puncture ng ating bladder. Okay, so basta kapag may tinutusok tayo, may ina-aspirate tayo na fluid, lagi natin bantayan si shock. Because risk for shock ang ating client if ganun yung ating procedure. Okay, aside from that, bleeding rin. Okay, kailangan nating i-wash out yung bleeding kasi may in-insert tayong needle. So that's all for paracentesis.